In this mini lecture, we're going to be starting on the second half of our unit on muscles. So during these mini lectures, we're going to focus in on the muscular system, so the skeletal muscles, and a lot of the gross anatomy of identifying skeletal muscles and what type of movements they produce, their names. So in this mini lecture, we're going to start off with just some of the basics about skeletal muscles, and then we'll get into specific skeletal muscles in different areas of the body that you will see in class. So the first thing we're going to look at is how fascicles are arranged. And I think in your note packet you have a similar picture, except for it has all of the different arrangements put on one page. So the first one that we see here, well, first of all, fascicles, remember, are bundles of muscle cells, right? So our muscle cells get bundled into fascicles, and then fascicles are bundled together to make up the entire muscular organ. So for example, in this picture, you can see a cross section through you can see a cross section through a muscle, and then you can see the individual fascicles that make up that particular muscle, right? So this would be a fascicle, this would be a fascicle, this would be a fascicle, and within there you can see individual muscle fibers or cells. This particular muscle, if you look at the diagram here, hopefully you recognize this as being the biceps brachii. But this muscle is an example of one that is a parallel muscle. And specifically, it's a type of parallel muscle called fusiform arrangement. So the fascicles and parallel muscle arrangements run along the long axis of the muscle. Fusiform parallel muscles tend to have a body. So in the center, they get a little chubbier, right? And then they kind of taper down at the ends where they become tendons. And that belly is going to bulge as the muscle contracts. The next fascicle arrangement that you can see is this is still considered to be parallel, but it's kind of like a subtype of it. This is parallel with tendons that form bands. So it's parallel with tendon bands. So we still have a parallel arrangement of the fibers, but kind of running across there, you can see the bands of tendons separating this muscle. And you might recognize this particular muscle that's found in the abdomen. This is rectus abdominis, is an example of a parallel muscle with bands of tendons. Our next example, this is actually still a parallel muscle too. But this one is a type of parallel muscle that wraps, and so it's a wrapping parallel muscle. This muscle might not be as familiar to you. It's kind of a small muscle, but the name of its action should. This is the supinator, and if you remember pronation and supination, the movements we can do, right? Supination, palms are facing up. Pronation, palms are posterior. So this is a muscle that is responsible for that action of supination. Our next type of fascicle arrangement is what's called convergent. So convergent arrangement is when the fascicles converge on one point. They kind of take on a fan shape like you can see here. And specifically the muscle that we're seeing in this example here is pectoralis major. And you can see that all of these fibers are running towards one location where they converge down here in a tendon. Our next example, a fascicle arrangement, is a type of arrangement called pennate. And pennate muscles, when they contract, they pull at one angle. This specific example here is what's called a unipennate fascicle arrangement. Pennate muscles kind of look feather-like. So you can see one here. This is the unipennate that we're looking at. This is actually a muscle called extensor digitorum. And from its name, you might surmise that it has the role of extension. And digitorum makes you think of digits. So it's a muscle that extends our digits. The unipennate ones have the muscles all running and coming into one tendon on one side of the tendon, unipennate. They don't move a tendon very far, but they are very dense with fascicles, and they have a lot of tension for the size of the muscle typically. So that's extensor digitorum. Another type of pennate muscle, and this one to me definitely kind of looks like the feather arrangement that we expect with pennate muscles. This one is a pennate, but it's a bipennate. And so a bipennate muscle has fascicles on both sides of the tendon. So here's our tendon, and we have fascicles on this side, and we have fascicles on this side. This particular muscle, large muscle in the anterior side of the thigh, this is rectus femoris. Rectus femoris is a bipennate muscle. And then our next arrangement here, we have another pennate arrangement, but this one is called a multi-pennate muscle arrangement. And so this is kind of hard to tell from the outside. This muscle up here that makes up the shoulder, it's one of our injection sites. It goes kind of has the shape of a triangle, the deltoid muscle. If you do a cross section through it, you'd see that it's actually like several arranged. So basically the muscle fibers kind of wrap around the tendon and they form individual fascicles. So when you cut it open, you can see that it's a multi-pennate. And each of those fascicles arrangements can be innervated by separate nerves, meaning that you can have one part of this contracting and another part not contracting depending on the movement that that muscle is performing. So that is a multi-pennate, and this was the deltoid muscle. And then our last arrangement of fascicles that we see are the circular muscles. And so the circular arrangement, and we see a couple of examples. These here around the mouth, we have orbicularis oris. We also have circular muscles around the eyes, orbicularis oculi. So these muscles are arranged typically around some kind of opening to our body, and they control things getting in or out or not getting in and out of our body. So like the sphincter muscles are also circular muscles. So muscles attach at least 2 points, and they use a lever system to produce their movements. And so the points at which these muscles attach, we give the term origin and insertion. So in this diagram here, we can see the motion that you should remember: flexion, right, and extension. So in this particular picture, we're seeing flexion happening, and we're looking at the action of a muscle called the brachialis. And so the brachialis here, you can see, is attached to the humerus, and you can see it's also attached to the ulna. So when we're doing this movement of flexion, and extension for that matter, what bone is remaining stationary? So the bone that remains stationary, right, is the humerus. So the humerus is the origin in this case. So origins are the stationary bones in a movement. So in this particular example, that would be the humerus. Now, the insertion, on the other hand, is the point of attachment on the bone that is moving, right? So the bone that is moving would be what bone? In this example, the ulna. The origin is going to be proximal to the insertion when we're talking about limb muscles. So a couple more terms related to muscles that you should be familiar with are a prime mover or the agonistic muscle and the antagonistic muscle. So in the example that we see here, we can see the same movement happening, right? Flexion again. But this time we're actually looking at a couple of other muscles instead of the brachialis. So this is flexion. That's happening in this picture. The agonistic or the prime mover in this action is basically the muscle that has the main responsibility. So it's the main muscle that is doing the bulk of the work in that particular movement. Most movements involve more than one muscle, but this is the main muscle. Now in this case, if you flex, right, if you do flexion and you put your hand on your biceps brachii here, you should be able to feel it contracting, right? So an agonistic muscle or a prime mover is the one that is contracted during a movement. So in this example, it's biceps brachii. Now, when you do the same movement and you feel your biceps contracting, if you take your hand, you put it on the posterior part of your arm, you should feel another muscle back there, your triceps brachii, and it should feel pretty soft and squishy, right? It's not contracted. So the antagonistic muscle is the one that opposes the prime mover. And it's not contracted, but it's relaxed. And in this particular example, it's triceps brachii. Now, if we look at the opposite movement on the next slide, here you see the opposite movement, right? So we were doing flexion earlier, and now we're doing the opposite, which is extension. So in this case, we're looking at extension. But think about what's happened with our agonistic muscle, our prime mover, and our antagonistic muscle. So when you have your arm extended, feel your biceps brachii, right? It's actually relaxed, right? So now our biceps brachii has become our antagonistic muscle, right? Because it's relaxed. And if you go back and feel your triceps, if you really try to extend your arm, for me, I gotta feel under some skin and some fat, but I can find my triceps down there and I can feel that it's contracted. So in extension, the prime mover is actually the triceps brachii. So these two muscles have flip-flopped their role depending on the movement that you're doing. So there are a couple other roles that muscles can take on. One is called a synergist. A synergist basically helps or assists in a movement. So in this picture here, you can see with flexion, right, that we have a couple of muscles that are synergists. We have the brachioradialis down here in the forearm. We also have the brachialis up here in the arm that are both synergistic. They're going to help with these particular movements. So they pull a little bit. They also stabilize a joint. Another term that's applied to muscles is a fixator. A fixator is really like a specific type of synergist. It helps to stabilize the bone that's attached, or stabilize, a bone that's attached to the prime mover. It prevents movement and a joint. So for example, in this particular movement, we have some fixators that prevent like the scapula and the shoulder from moving during this movement. So like there's a large muscle on the back called the trapezius, some smaller muscles called the rhomboids that prevent the movement of the scapula when we're doing this particular motion. So they would be considered fixators. A couple of kind of rules about muscles and movements that are helpful as you're learning muscles and learning what movements they produce is this first one about flexion and extension. So the joint where you have flexion and extension, the muscles who cross on the anterior side are going to be the flexors. If you are crossing on the posterior side, then you're going to be the extensors. So the example that's here, right? So we have the biceps brachii again. So here's our biceps brachii. and it crosses on the anterior side of the elbow joint. So here's our elbow joint down here, right? And it's in front of the elbow joint. So it's a flexor of the elbow joint. Back here, we have the triceps brachii, and it crosses posterior to the elbow joint, right? It's on the back side of the elbow joint. So it's going to be an extensor of this particular movement at this joint. Another example with the movements abduction and adduction. So at joints that have abduction and adduction, like we see here at the ball and socket joint between the femur and the coxal bones, the muscles that pass by the medial side of the joint are going to produce the movement of adduction. So here you can see on the medial side, so here's our joint, right? And this would be towards the midline, right? The medial side of it. We see a muscle called adductor magnus. Now also from its name, you probably could deduce that it's an adductor. Now on the lateral side of one of these joints, that does adduction and abduction, we have another muscle here. This is gluteus medius. And gluteus medius, and actually also minimus, both of them, cross on the lateral side of the joint. So if you're on the lateral side of the joint, the movement that you're going to be doing is abduction. Okay, and then our last one here is about rotation. And so the joint here that you can see is the shoulder joint, right? So you should recognize the scapula, and you can also see a bit of the clavicle in there, right? So here's our scapula, here's our clavicle, here's our humerus, and here is our ball and socket joint. So at joints that permit rotation, right, where they're able to rotate, right, within that joint, if the muscle is on the posterior side of the joint, it's going to be a lateral rotator. So back here you have a muscle, for example, called the teres minor that you can see right here in the picture, that it is going to do lateral rotation. If you're on the anterior side of the joint, so here there's a muscle called the subscapularis. So you can see it here and a little bit of it here. It's going to be a medial rotator. So lateral rotation, medial rotation. So just some rules to kind of help you out with figuring out the type of movement that's going to happen in a joint. Okay, the last thing we're going to look at is how muscle fibers are named. And so there are several different, the more that you learn the terminology of A&P, then the easier the names of the muscles will come to you, and it'll also help you tell a lot about them. The first way that muscle fibers are named is by the direction of their muscle fibers. So for example, an oblique muscle means the muscles are going at an angle. So for example, you can see an oblique muscle right here, right? These fibers are running at an angle. Rectus means straight. Like to rectify means to straighten out a situation. So these are rectus muscle or rectus fibers, except for those two I just crossed because I wasn't drawing very well. But that's abdominis rectus. Another way that they are named is by the relative size of the muscle. So for example, we have medius muscles and minimus muscles and longus muscles and longissimus muscles and brevis muscles. Like to abbreviate means to shorten. So a lot of muscles have something about the size in their name. And I accidentally put that one in here twice. So scratch out the second number 3, which is relative size. This is the real number 3. This is the location of the muscle. So another way that muscles are named is where they're located. So for example, femoris. That tells you that the muscle is probably near a bone, right? The femur. Ocular muscles. Ocular means eye. Brachialis, right? The brachial region meant the arm. Tibialis, anterior. So it's probably in the anterior side of the body and probably near the tibia. So I can tell you about their location. Another thing I can tell you is the number of origins. So for example, quadriceps muscle. Quad means 4. It's 4 origins. Tricep, 3. Bicep, 2. Another way to tell where the name of the muscle will tell you is the location of where it is originating and inserting. So, for example, we have a muscle called the sternocleidomastoid, which you can kind of see in this picture here, kind of running down this way. And so it has, it attaches to the mastoid process back here. And then also, cleido means clavicle, and then also sterno, the sternum. So it attaches in all three of those places. And another way, or another clue to a muscle's name, is sometimes it tells you something about its shape. We talked about the example of the deltoid earlier. Delta is a triangle, right? Delta. And that particular muscle is kind of triangle shaped. It's bigger at the top and then comes down to a point. We have a muscle in our back called the trapezius, which you can, well, you can see the deltoid in this picture, right? Back here, you can also see the trapezius. You can see it better on this side because it's been reflected in the other picture, right? That has kind of a trapezoid shape to it, if the other side of it wasn't reflected. And then the last thing that you can learn about a muscle sometimes is its action. So muscles, as we looked at a few examples earlier, are named for the action they produce. Like abductors are probably going to abduct something. Extensors are going to do extension. Flexors are going to do flexion. Supinators are going to do supination. So while muscles sometimes seem a little bit overwhelming with the names and all the things to try to identify, that if you put together or put your knowledge of the language of anatomy to use here and what we learned in bones, you will find that will come to you a little more easily.